In this episode,
I fell 12 feet head first, crushed 4 vertebrae in my neck, was paralyzed from the neck down.
No way.
I was. It was not one of my better days. He said you'll probably, because there's no severance in the spinal cord, you'll probably get some feeling back and some mobility back. He said you've crushed 2 vertebrae in your lower back, broken 5 ribs, split your sternum, ripped your right arm out of socket, and then jammed it back in. I hit a rock wall on the way down. In 2 hours' time, I had more recovery than 14 months of physical therapy.
So.
The pain was almost completely gone. I got off that table and I said, I got to do this.
Hello and welcome to Health in Focus with Jacobus. I am your host, Jacobus Hollewijn. This is part 2 of my interview with Lee Forbes. He is part owner, together with his wife, of Aruka Touch, Inc. in Beckley. I say that correctly?
Yes.
Beckley, West Virginia. Our first part was primarily explaining what happens in the body when we have an injury, when we have pain. What is the body telling us through creating an imbalance? And so trying to balance that back into position, and then pain will go away because blood flows better, lymph flows better, the nerves are flowing better. In this part of the program, we are talking about his own history, what happened in his life, why he got involved with Aruka Touch. And we will also talk about some of the other modalities that are out there that many of you are aware of, as well as some of the limitations that Lee has discovered his work, Neuromuscular Balance, may give him, some of the limitations, and then some other therapies that he and his wife have decided to implement in their practice to make a more complete therapy for the people who come in. So Lee, thanks again.
Well, thank you
for being here.
It's been a privilege to be here.
It was nice to kind of take a short break and then start up again. And
yes.
So I was fascinated with your explanation and helping me to understand certain things better. Mm-hmm. I've been doing this for 30 plus years, but there's always new stuff I learn. And when you start talking, my wheels are spinning, trying to give it a place. I need to understand where this fits in. Mm-hmm. And so it is a fascinating topic. And I know that physical health is important to everybody. I would say indeed. Pretty much everybody. And some people are so healthy, they never have an issue, never don't think about it. But most of us will have aches and pains and issues that come up because of an injury, a fall, an accident, a whiplash, a concussion, something trauma that happened to us in the past. In the first interview, you talked about PTSD, even with veterans, for example, or anybody with PTSD. I want to understand, what was it in you, what happened to you, why you got involved in this field?
Okay. Well, let's back up a few years. When I first got out of high school, I went into commercial diving. I was a deep sea diver for a couple of years.
No way.
Yeah.
Wow.
And it was, I thoroughly enjoyed
That's
the
different.
work. Yeah, indeed.
Commercial diving.
Yes. We did salvage work. We did yacht and ship repairs underwater. And we could do all kinds of things underwater people didn't realize you could do.
Takes all kinds of people to make the world go round.
It does. But the unfortunate side of that, to one extent, was that our work was almost always in 0 visibility. You could barely see your hand in front of your face. Now, how does that tie into what I do now? I learned to see through my fingers. And being able to see through my fingers, to manipulate things with my hands that I could not see. And most people, they're very focused on what they are able to see. I mean, they're limited to that point. So by being able to focus my vision through my fingers, that has played into what I do today. In that, being able to feel what's going on inside a muscle, being able to detail out muscle cells and in the condition that they're in, the tension that might be there, the knots in the muscle, the ischemic knots that we had talked about previously, being able to feel those and know when they relax. It just always getting these responses from clients when I can feel a knot that has been causing a problem somewhere else down the chain resolve itself, just soften under my touch.
Right.
And I'll say, oh, there it goes. And they'll go, you felt that? Type thing. So just to give you an idea, when we were in school, they wanted to test our sensitivity in our touch. So what they had us do was take and put a hair between 2 pages in a book, and you would trace that hair. Then you would add another page and trace the hair until you added so many pages that you finally couldn't sense the hair at all.
So,
For most people, that was somewhere between 12 and 15.
no way.
Yeah,
12 to 15
12
pages?
to 15 pages. Absolutely.
Wow.
I was at 35.
So,
And my instructor was at
I
50.
thought that maybe you were going to say 2 pages.
No.
2 pages.
Yeah, so at 35, I thought it blew my mind that I could still sense that. So when I'm working with people, that's where that comes from is what I learned, how I learned to see through my fingers. Then I became one of North Carolina's first paramedics, and I was a hospital-based paramedic for a number of years. During that time, I was able to pick up on a lot of not just emergency medicine, but I also assisted in surgeries and did other things since I was hospital-based. I began to get disillusioned with what I was seeing in Western medicine because to me it seemed like there should be ways of helping resolve people's issues without constantly throwing drugs or surgery at them. And so, utilizing all the information I was learning about the body during this period of time, and I think I told you on the side I started doing roofing so I could make a living because paramedics can't. And then I became specialized in historic roof restorations. Now, how does that play into what I do today? In my work, it was to go into these historic properties and look at where they were having issues with leakage or something of that nature, some failures in the roof systems, the gutter systems, and so forth. I had to reverse engineer where the issue was coming in.
Where did it start?
Typically, if there's a leak in a house, it's not directly where the leak is. It's somewhere else. And so I began to reverse engineer these things, became very, very good at it, and traveled all up in the East Coast as a consultant, troubleshooting these issues. So let's take that into neuromuscular balancing. So that is what makes me different than other people that are typically doing neuromuscular work is that I work to reverse engineer the pain is here, the drip is here. Where's it coming from? Okay, so now during that 40 years of working in that field, I had 10 falls. Broke 24 bones over that period of time. In 2012, I had a fall that I fell 12 feet head first, crushed 4 vertebrae in my neck, was paralyzed from the neck down.
No way.
I was. It was not one of my better days.
No.
And fortunately, immediately, when I came to the realization of what had happened, I was head down the dirt. My body crumpled over me. I couldn't breathe, and I couldn't move anything. And so they came in, extricated me out and from the bushes and medevaced me out to the hospital. Yeah. And I was laying there in the emergency room. And the doctor is telling me everything that's wrong. You've got 4 crushed vertebrae in your neck. We're going to have to fuse your neck.
Yeah.
He said you'll probably, because there's no severance in the spinal cord, you'll probably get some feeling back and some mobility back. He said you've crushed 2 vertebrae in your lower back, broken 5 ribs, split your sternum, ripped your right arm out of socket, and then jammed it back in. I hit a rock wall on the way down. So he tells me, he says, do you have any questions? And I said, when do I get to go back to work? because I could feel a little tingle in my big toe.
Uh-huh.
And I thought, okay, this is going to be all right. And he said, Mr. Forbes, you'll never work again. You're going to be on disability for the rest of your life. And I'm thinking, you don't know me. And so he said, do you have any other questions? I said,
But that is interesting. Now you do explain exactly what happens to everybody who goes through that modality, emergency medicine,
yes,
right?
yes,
They're able to put you back together, but they also give you diagnosis. You will live or you will not live.
yes.
And then to
Or
some
you'll live
people
with that pain from now on.
to some people it means it's a dead end, no pun intended.
No.
To other people it means, okay, we got work to do.
Yes, absolutely.
Yeah.
Which is a very important point because it is so much. We talked in our previous time about how everything is interconnected and how our mind has so much to do with what we are able to accomplish as far as getting better or worse. And so when someone tells you, most people, I have people come into my office all the time. Well, they've told me, doctor said, I'm just going to have to live with this pain for the rest of my life. And I'm thinking, no. Don't buy that yet.
No.
Until we've done everything we can do, don't buy that yet. So, he said, so he asked me, he says, do you have any other questions? I said, I just want to know when I can get back to work.
Yeah.
And he said, you're not listening. He said, you're going to be on disability for the rest of your life. You'll never work again. My parents knew not to tell me never because they knew I'd do it.
Yeah.
So anyway, that was on a Wednesday. And I said, all right, question. How long am I going to be here? He said, you're going to be here 3 to 4 weeks. You'll be in rehab for 4 to 6 weeks.
Okay.
And then you'll be going home. And I said, so you're telling me in 2 months I can go back to work? He says, no. He said, I'm telling you in 2 months you can go home and start rehab there.
Yeah.
Okay. So that was on Wednesday. The following Thursday, because once they fused my neck the next day,
Yeah.
I was up and doing stuff and they didn't know about it. I was going to the bathroom by myself because I'd gotten enough mobility I could hold on to things and try to get there.
Where was you feeling at this point?
I could feel probably about 50%.
Okay.
I had gotten to that point.
Your limbs could feel your limbs
I could
a little
feel
bit?
my limbs. I could move. I was horribly weak. I couldn't wipe my butt. I couldn't lift my hand to my butt level. I could pull it up, a little bit. I'd gone from a 100-pound grip to 4. I'd gone from a 30-pound curl to 3.
Wow.
I had no pinch strength at all. And I could feel very little detail in anything. And so a week and a day later, the following Thursday, they said, well, you're progressing so fast, we're going to send you to rehab. I said, great. So I get to rehab, and she says, they did the assessment on me. They said, what do you see as your prognosis? And I said, they had a kitchen there. Okay. And like I told you, I used to have a restaurant. So I baked all of our breads. We did specialty sandwiches. And so I told her, I said, you got a kitchen here. I said, 1 week from today, I am going to bake enough bread in there to feed everybody on this floor. She said, if you do that, we're going to make baking a therapy. So that was on Thursday. The following Thursday evening, I had my wife bring my mixer and the ingredients. It was a struggle. Yeah. I baked 8 pounds of bread that evening.
Yeah.
Everybody on the floor got fresh baked bread. The next morning, the doctor comes in my room and he says, Mr. Forbes, we can't do any more for you here. We're sending you home. So 2 months went to 2 weeks and 2 days.
Wow. At
2 months, I climbed a scaffold to get on a roof just to prove my point. I nearly fell off, but I did. So in that whole process, I'm thinking, okay, we can do this. We can do this. Mm-hmm. A year and a half later, my wife found out about this therapist who had developed what he called structural balancing down in Asheville, North Carolina. We were in West Virginia. So we drove down there, spent 2 hours on his table. In 2 hours' time, I had more recovery than 14 months of physical therapy.
So
the pain was almost completely gone. I could feel things I hadn't felt. I had more range of motion. I got off that table and I said, I got to do this. And he has a school in Charlotte, North Carolina. He has another one down in Florida. So we eventually got to the point, both of us went to a school in Charlotte and became licensed in body work
Yeah.
and structural balancing. So now we bring this home. We've got our licensure, we set up our practice, and I'm thinking, what if I take all of my experiences of the past
You bet. Why not?
and
Which
pull
you do
that
anyway,
together?
right?
Exactly. And so where a lot of people will learn something new and they just throw out the past,
Yeah.
I'm thinking, well, let's incorporate everything.
The past is what got you here.
Exactly.
Yeah.
And so I started utilizing that in determining, because what I was finding out was if somebody hurt in the bottom of their feet, and I went down and I worked on the bottom of their feet, I didn't accomplish anything.
Yeah, you're not doing them a
You know?
service.
And so, but if they came in and they had pain at the bottom of their feet, and I start thinking, hold it, what could be causing that? And like we were talking last time, when you've got muscles that are tight on one side, the body compensates. So it has muscles on the opposite side pull up to try to balance that tension. The battleground becomes the spot between them.
Yeah.
So if you've got calf muscles that are super tight, and it's pulling down on the foot, causing you to plantar flex, we call it.
Right.
So you're pulling down on the foot. Well, then the body says, "Whoa, that's too much. We can't do that." So it kicks in the shin muscles and starts trying to pull the foot back up into what we call dorsiflex.
Sure.
So as it comes up into dorsiflex, now we've got two muscles that are fighting. So where's the pain? It's in the bottom of the foot or around the heel. Plantar fasciitis.
Yeah.
So by releasing the tension in the muscles of the calf and the shin, pain goes away in the foot. 2 hours. Someone comes in with plantar fasciitis, they walk out, they don't have any pain. People that have had, I had one lady, she came in, she was so distraught because for years, she was in her early 60s, for years she and her husband would always go on walks in the evenings.
Yeah.
Her plantar fasciitis had gotten so bad that she could not get out of bed to go to the bathroom at night without putting her tennis shoes on. And I said, well, what do you want? She says, I want more than anything to take a walk with my husband. Okay, 2 hours later, this woman was walking on a concrete floor barefoot with no pain. And absolutely ecstatic. Started crying, gave me a hug. That's where the real reward is, you know? So,
because you only see them for, let's say, a short period of time.
yes.
But they carry their baggage into your office. They carry your baggage into your practice. And then you never get the complete story, but you know where the body is blocked. And so for them, for you to help them, is you don't understand sometimes what that means, how it changes their life.
Oh, it's incredible. It is incredible. I've had so many people tell me, you have changed my life. I work a lot with neuropathy, people that have diabetes that'll have neuropathy in their legs or arms. And when they come off the table, they can feel. And they're going, this is amazing. And it's such a rewarding experience to be able to help people to get there. And knowing, it's like I had a client come in to tell me, because I tell people in the beginning of my assessment, you know, our initial visit is 2 hours. 30 to 45 minutes is just interview and assessment. I want to know everything I can about their past history. I want to know, you know, if some woman comes in and she's got a bad shoulder, I want to know, were you at any time involved in sports?
Yeah.
Oh, well, I was a cheerleader 30 years ago.
Yeah.
All right. Did you ever have any bad falls? Well, of course I did. Did you fall on a shoulder? Yes, I did. Okay, let's take a look at the muscles that may have locked up then and see if they're still tight. Boom. We start palpating the muscles. Well, there's tension in here. It's sensitive there. I'd never hurt down here before. I never realized it. We release this down in here. Shoulder loosens up. Boom. Or the pec minor as well. The shoulder loosens up. They've got their range of motion. No more pain.
So when you did your studies, your training, was it pretty much almost like a recognition, an inner recognition, or for you, kind of a memory like, I know this, this feels very natural to me, did you learn something that was, well, obviously you learned some new things, but sometimes when we are, when we have a passion, and obviously you're very passionate about this, the learning almost becomes so easily because everything makes sense. It's easy to remember because it makes sense.
Yes.
Is that kind of what you had when you did the study?
Yes. As a matter of fact, it blew my mind.
Yeah.
Because I had, all of my life, I had a reading handicap. And so when I barely made it through high school, it wasn't because of my comprehension and going into college, because I could only read word for word. I couldn't. I was extremely slow, so I couldn't get into all the information. And then I learned how to read when I was in my mid-20s, but still not fast. So school to me had always been a bad experience, because math was great. But if it was something I had to read, I was having issues with it. So then when we go to school and we've got to take a very intensive anatomy and physiology plus all the kinesiology and everything that we had to do, and I'm thinking, this is going to be rough.
Yeah.
Maintained high 90s all the way through. It was like you said, I've been here. I belong here.
Yeah.
And so then when it got into actually doing hand work, I've always worked with my hands. And being able to palpate so deep and feel things that most people couldn't feel.
Yeah.
And so, it was like, I'm coming home. And then to have the positive response that we started having.
It's only verification.
It was.
That
It
you're
really
doing the right
was.
thing. Yeah. Interesting.
And it's in when people have a gift, if they can learn how to capitalize on that gift, it's so important. I had a chiropractor bring his son to me one time. His son had developed a pain in his hip, and he was a basketball player. He was a young teenager. And so he had one leg that was longer than the other. And so the chiropractor had worked on him, and he said, I get his legs evened up, and I've done it 5 times, and they go right back out. He said, Lee, I'm not sure what to do with him. He still has the pain. He still has the limitation. Can you do something with him? So I started looking, and like I said, putting history together. The year before, they had gone on a cruise, and he had slipped and fallen and done a split on this cruise.
Oh, wow.
And I'm thinking, pelvic floor. So I checked the muscles in his groin, his pelvic floor. Sure enough, one side, the ischial cavernosa muscle, they're on both sides. One side was puffy, the other side was relaxed.
Yeah.
I relaxed that puffy side, got them both to where they were balanced, adjusted the muscle tension in his hip.
No.
He comes up. His legs are the same length.
Wow, that quickly.
He has that quickly. In 45 minutes, his legs were even. He comes off the table. He has no pain. He has no limitation. He can run. He can walk. He feels great.
Yeah.
And his father looks at him. He says, I want you to take note. He said, I went to school for 8 years. Lee went to school for less than a year for this.
Yeah.
And he can do stuff I can't do.
Yeah.
And so it's like we talked about before, there are modalities and ways that people can get out of pain without having to go drugs, without having to go surgery, without having to go through certain types of therapy that just aggravate the situation. That's what we're all about.
Yeah. So then when you compare, now you mentioned a chiropractor, so the chiropractors will be limited, a massage therapist will be limited, a physical therapist will be limited, you also will be limited. What are your limitations?
Typically, my limitations are tears and breaks.
Tears and breaks.
If there is no tear, like a ligament tear, tendon tear, and if there are no breaks, without exception thus far, we've been able to resolve the pain. Our resolution has been 90+%. Anybody that of all the people that have come to see us, and so that's the biggest one.
Yeah.
Now, sometimes we'll run into issues where the people are so negatively focused. They have been through so many different modalities to
Right.
try to get fixed, whether it's been surgically, whether it's been steroid injections, whether it's been physical therapy, chiropractic, whatever. But they have done it for so long, they've become so negative in their thinking that we have to stumble through for a little bit,
Right.
get a little bit of improvement
And confidence.
and confidence, and then they'll make another. If they see some improvement, they'll be back in, usually within 2-3 visits, we're in good shape.
Huh. Interesting. Strange question.
Okay.
The eyes are surrounded by muscles as well. Have you
Yes.
worked with people helping them with nearsightedness or farsightedness? Because many times I understand it is the musculature around the eye that squeezes the eye into a certain shape. Is that something you've ever worked with?
No.
Could it
But
be done?
everything has been a first time. You know,
Sure.
I've been able to open sinuses. I've had a positive effect on cancerous tumors, utilizing pulsed electromagnetic frequency. I haven't done anything with the eyes yet,
Yeah.
but I'm
just
I'd
wondering.
be anxious
Well,
to
like those
give
are
it a
interesting.
try.
Those are interesting
Yeah.
muscles that we don't even think about. But
that's
when you
true.
talk about eye, so many people have eye problems, and
Yeah.
it is because the muscles are so tight.
Mm-hmm.
You know, I'm one of them. I wear contact lenses, and I know that it is one of the issues is because the muscles are so tight. And you can do eye exercises, but I've tried that. It is very tiring.
Yeah.
And so there must be, I wonder, when you talk about balance in the body, creating balance in the body, I wonder what the opposite of the eye is, where the tension starts, what it is.
Oh, you got me thinking now.
Yeah, good. Because I got glasses when I was in fourth grade, fourth or fifth grade. And so that is pretty young.
Yeah.
And then you have that to life. Wow, interesting. But when it comes to limitations, you have also felt that in your practice, you may integrate a few other therapies that could accelerate healing or that could enhance healing, or it could be something else that people should use in order to find a better balance in their life. What are some other therapies that you and your wife decided to integrate in Aruka Touch?
Well, one of them, excuse me, I mentioned that I use pulsed electromagnetic frequency.
Pulse electromagnetic frequency.
We have a unit called the Electrons Plus. It's an exclusive unit. There's only about 300 plus in the world of these
wow.
units.
Wow.
It supercharges the negative energy that comes out of the earth through me, and wherever I touch the individual, it's concentrated. And I can set the frequency, I can set the intensity to be able to work more deeply into the muscle. It does a few things.
What do you mean it goes through you?
So
you have it attached to
I
your-
haven't. So I put a
Is it
plate.
a vest that you put on or something?
No. I have a just a little electrode that I attach to my back with a line.
Okay.
It's a ground line that goes
Okay.
into the unit.
You bet.
And then there's a plate that I place underneath the patient. And so when I touch them, it completes that circuit. So that negative charge comes through me, comes through my hand, and then goes into whatever tissue I'm working on. So if I'm trying to get a muscle to relax where I found a knot, and I set the frequency and the intensity and at the proper settings, then I can just hold on to that knot, and it will cause that muscle to relax and
Okay.
break that fascial adhesion or ischemic knot
Really?
up. And then again, I can also utilize it to stimulate neural development. People that have had problems with neuropathy.
Neuropathy.
And that
That is not just even diabetic neuropathy or primarily neuropathy from an injury.
both.
Oh, wow.
Both. We've had tremendous effects. And what's interesting too, every time so far that I have utilized this piece of equipment on a diabetic, their sugar level has dropped anywhere from 20 to 80 points
Wow.
in that 45 or an hour long period.
Session. Wow.
So just phenomenal what we're able to do with that. So we utilize that, and it's also rated by the FDA with a frequency of 7 to have a positive effect on non-drug responsive depression.
Really?
So now we
So depending on the frequency, you can work on different ailments in the body,
Yeah.
if I can call it that way.
sure can.
Huh, wow.
So that's one of the things.
I mean, the
that
body
we
is
utilize.
electric, so that is
Indeed.
Yeah.
And we're just learning so much about the energy levels and transitions that energy has in the body. So utilizing that, then to couple with that, we have I took a massage table, and being a copper fabricator, I made a copper cover for that massage table, and then I grounded it.
Huh.
And so then over top of that, we took and installed a pulsed red light therapy. So now we're using near infrared over top of the patient, lying on a grounded copper platform. That's warm.
What
it's
is
heated.
what is on top of the copper? Is there a mattress or
Nothing.
Nothing.
They're just laying
They literally
flat
on-
on the copper, literally laying on the copper.
Huh.
So their body is in contact with copper, which is also very good. I mean, we've seen that. So during a 20 minute to hour long session, it's incredible the response that people are having with that, especially from an emotional response. So what red light does, it supercharges the mitochondria in the cell.
Yeah, that's right.
So now we're getting some fuel going in there. And so with a pulse, a red light generally causes the cell to expand, and as it does, it absorbs the nutrients in the fluid around it.
Yeah.
With a pulse, then when the light goes off, then during the pulse, then it excretes the waste, theoretically.
Okay.
And then when the light comes back on, it absorbs. And we can set that at numerous frequencies with the pulse. So that's
I
something
want to
we
jump
do.
on for a moment. So when
Sure.
you work with the mitochondria are the energy centers inside a cell, and it is sometimes it could be 1,000 mitochondria in one cell. So when the nutrients go in, and then you do something with the pulse electromagnetic machine, it also gives the mitochondria a chance to release, let's say, the toxins or whatever is done, the ashes. I always say
Sure.
it's a fireplace.
Yeah,
And when you
that's a
want
good
to
idea.
put wood in the next night, you want to clean out the ashes first. So we got to clean it out. And that then needs to leave the cell to get into the intercellular fluid. That's what you're talking about.
Yes.
And that takes it down to the lymph system out of the body. And so you're helping to stimulate that with the copper and the red light, or just the red light.
Both.
Both. Okay.
So, which is such an amazing healing modality in itself. But now what we've done though, we've taken waste from the cells and we've dumped that into a system that typically is already toxic. Most people are toxic to a degree. And so now what do we do about detoxing? Well, there are numerous ways of detoxing. We chose to incorporate colon hydrotherapy.
Yeah, colonics,
So-
colon therapy.
Yes. So we have a class 2 medical device. It's called the Angel of Water. It's an open system. So you just relax back in a reclined position. You self-insert a small tube, smaller than your pinky, and then we just gravity feed 8 to 14 gallons of water through the colon, and then we clean you from the anus all the way to the cecum.
Yeah.
And that's very refreshing, especially for people that are suffering from chronic constipation or IBS or those type of things.
Yeah.
So those are the different kind of modalities.
You put anything in
that
the
we
water?
use.
You
We
put
don't. We
chlorophyll or so in it?
just use a filtered water.
Ah,
It goes through a sediment filter, and then it goes through a blue light filter, and
yeah.
there you are. And I do it. I mean, we both do it ourselves.
Sure.
Every few months, just to get everything
Do a few
cleaned out.
treatments, or you do one treatment then?
We'll do one treatment.
Yeah,
and then so
That's excellent.
And my wife Katrina typically runs that unit
Mm-hmm.
because I'm so busy working on people.
Well, the colon hydrotherapy is indeed something that many people are, well, not many people are doing, more people than we often think, who, of people do enemas for sure, but colon hydrotherapy is just a much deeper system because it not only lets water enter, but also helps to remove the water as it is working its way all the way to the cecum.
Yes.
Right?
And you'd be surprised how many people are so dehydrated that the first gallon, sometimes even 2 gallons, is absorbed by their system before they even start to
Release. So,
yeah, it's crazy sometimes.
and these are even people, let's say somebody comes to you and says, well, I'm constipated. Okay, I get that part. But there are also people who say, I go to the bathroom once or twice a day, and even they could have this dehydration going.
Exactly.
Huh.
Yeah.
Wow. I mean, the intestines and the brain are working very closely together. So they probably find there is some clarity. I often notice, I always tell people when they say I do a fast, I tell them, are you doing enemas or do you do colonics? Because, they don't do it. I said, well, if you don't have that pressure from above where you bring food in or liquid, well, liquids they do usually, but food in, nothing is pushing down, then whatever is in your intestines is stagnant.
Yes.
And when it is stagnant at 98.6 degrees and it's dark and moist,
Yeah.
then what can happen is that toxicity starts to leach into the bloodstream, and then people get these headaches and they get irritability when they do a fast. And I think a fast should be a very special time. You should make time for a fast. Sometimes it's best to be able to, especially when you start out, to give yourself a day or two where you say, I'm not going to eat and I'm going to do enemas and colonics. If you get better at it and you can do an enema or colonic in the morning or at night and you want to go to work the next day and you can do that, that's fine. But some people try to work and do this cleansing. Could be a little hard.
It is.
Yeah.
And to bring to point too what you were just saying about that clarity of mind, what most people don't realize, there's communication between the brain and the gut.
Yeah.
We typically think that the brain does most of that communication, but in reality, 80% of the communication between the brain and the gut goes from the gut to the brain.
Correct.
So if that gut is impacted, is like you said, is just percolating all of that bacteria that's in it because stuff isn't moving out.
Yeah.
Now we're absorbing that back into the system and they're getting that, the neural response and everything. Yeah. So it's an excellent idea to get your system cleaned out ever so often anyway.
Yeah, it is necessary. It's always number one is what do you eat? What do you put in the mouth? But I tell people the digestive tract is actually outside the body, considered by medical professionals outside the body because there is no blood anywhere.
Exactly.
So the system with its symptoms have to do with either what is not working through, well, number one, what did you put in your mouth? Do you have enough enzymes or stomach acid or pepsin in the stomach? Do you have enough enzymes from the pancreas in the duodenum? Do you have enough probiotics? Is there a yeast overgrowth? Whatever is going on, it can also be a history of abuse that can cause intestinal problems, and whatever leaks into the bloodstream starts affecting the body and the brain as well. I don't know and how far it would affect the tightness in the body, but maybe you have seen a connection between diet and stress and tightness in muscles and injuries that people have.
We have.
You have,
we have.
huh?
Because if we think about it, the pelvic floor
Yeah.
is the foundation of our core. So if you are putting pressure on the pelvic floor because the bowel is unable to release, now bear in mind the large intestine, the bowel is 2 inches in diameter,
Yeah.
approximately, but it can expand to 5 times that. So you have most people are walking around with between 5 and 35 pounds of fecal matter in their intestine. And you can,
I didn't know it was that much.
oh yes.
I know John Wayne had a lot. But,
yeah, so we've read. But you figure if it can expand 5 times, that 10 inches in diameter is
Wow.
how big the colon can get.
Wow.
So if you pack that with fecal matter that's
Yeah.
not moving,
Yeah.
so now what we're doing is we're putting pressure on what we were talking about earlier, the iliacus muscles that are in the pelvis, the muscles in the back of the pelvis, the piriformis, the obturator internus, these 6 muscles that are lateral rotators of the hips. Those muscles then become tense and get a lot of strain on them. And then if you have that issue continuing, when the piriformis tightens up, then it impinges on the sciatic nerve. And now we have sciatica. And so sciatica basically is just an impingement of the piriformis muscle
Okay.
under the large glute. So when you can release that muscle, then you release that impingement, all the pain down the leg goes away. But if you have an issue, obesity is not always the issue. A lot of people, skinny people, have a lot of impaction. So now we're putting a lot of pressure down in
Yeah.
the lower portion of the pelvic floor.
Yeah, some people put, let's call it the fat, call it all this, on the inside when they look pretty slender on the outside, but it goes around all the organs. And other people may have maybe
Yes.
overweight that comes out. And often you check those people's, their blood pressure is normal, their, let's say, cholesterol, if that's important, is normal. It is just that they put it all on the outside. So there is not always a guarantee that somebody is slender built that they're healthier than the person who is overweight.
And
let's say.
then when you get
I mean,
into-
obesity obviously is an issue,
right.
and you don't want to be overweight. But yeah, it's very, very interesting.
Then when you get into the diet that people have and the fact that now so many people, and this is going down another rabbit hole, but so many people have fatty liver disease
Yeah,
that have never had alcohol,
right.
that typically think that they're fairly healthy, but they're eating seed oils and
Correct.
high
Omega
fructose
6s,
corn syrup
yeah,
and all the omega 6s
yeah.
and all that garbage. Yeah, it's a mess.
I do want to ask you one more question. You asked me, you said, ask me about the lady who's 27 years old. You had a great story. I haven't heard the story, and I'm curious.
Okay.
Before you
So,
leave.
all right. So,
You know what I'm talking about?
oh yes,
Okay,
I
good.
do.
Yeah.
So we were talking about the iliacus and the psoas and how it locks up when people are in sitting positions, and that causes back pain.
Yeah.
Okay. Now those muscles are a part of the pelvic floor,
Correct.
the pelvic muscle.
Yeah.
This young lady came to me over 2 years ago. She was riding a horse, and the horse reared up on her and went all the way back
Huh.
and centered her.
Wow.
Landed right on her. They thought she was going to be dead when they
Wow.
got to her.
Was she paralyzed?
She was not.
Wow.
She was not. Remarkably, she was just bruised. But within a week, she developed urinary incontinence to the point where she would have to go every 15 minutes.
Huh.
Well, they did everything they could figure out as to what could be causing this.
Right.
So they sent her to a physical therapist that did internal pelvic floor
Correct.
work.
I know about that.
Okay. Well, if you don't get the right muscles, then you're not going to get the right response.
Uh-huh.
And so she went through that for an entire year, had no response, no positive response. So the only way they figured they could do it, they was to do intervaginal injections of Botox into her bladder.
I see.
So paralyzing the bladder enough to the point where she would only go every few hours. Now, it only lasted 3 to 4 months.
Correct.
And like she said, after she had that procedure done,
So she did it.
she did.
Okay.
She's had it five times, and she said after she has that procedure done, it feels like she's got broken glass in her uterus.
Oh, wow.
For 2 weeks or something of that nature.
Huh.
So, a friend of hers is also a patient of mine, and has been to see me about childbirth stuff and whatnot. But anyway, doing body work on her. Not that I do anything with childbirth. Anyway, she said, you need to go see this guy. So she comes to see me. And in the process of our conversation, I asked her, I said, what can you tell me about the fall? And I do this with everybody.
Sure.
I want to know if you've been in an accident, if you've got whiplash. Whiplash typically is a problem of the anterior muscle, the anterior neck muscles. The longus colli, the longus capitis, those muscles will pull up tight and they pull forward. That causes strain back here. So now we've got the pain back here,
right,
but the problem's up here. And almost nobody goes there to unlock these muscles. Well, why did I go there? Anyway, so she came to see me. In the process of talking to her, I asked her, how you walk me through what happened. So she walks me through how the horse landed. I said, did it land more to one side than the other? She said, yes, I did curl up on to my right side a little bit more.
Okay.
I palpated the psoas muscle. So as we said, goes from the 12th thoracic rib down all the way down into the groin. Very tight, very engorged.
Huh.
I released that muscle and then went down into the pelvic floor, the exterior pelvic floor muscles.
Yeah.
And when I felt the ischial cavernosa muscle, which is that muscles on both sides of the ureter, when I felt that muscle on one side, on the right side, it was very thick. Like
this
3
was almost
times.
comparable to the young man the basketball player.
Yes.
Kind of similar.
Very similar.
Okay.
Very similar.
Yeah.
And so hers on the right side was about 3 times thicker than it should have been.
Now you couldn't see it on the outside. You had
Couldn't
to feel
see
it.
Had to
Right.
feel it.
Okay.
So I'm feeling at the top of the leg, just inside the
groin area.
edge of the ischium.
Yeah.
And so I could feel that muscle, and it's like 3 to 4 times the size of the other side.
Wow.
So just by having gentle but consistent compression of that muscle with the use of that pulsed electromagnetic frequency,
You bet.
that muscle relaxed to the point where it was balanced with the muscle on the other side.
Huh.
That evening, she went home, no problem.
Never had a problem again.
She did not. She said, I woke up several times simply because I knew this was my scheduled time to pee. And she said, I didn't have to pee.
Huh.
No problem.
Wow.
So
That's impressive.
yeah.
Yeah.
And
And it is literally the body talking to you.
exactly. Exactly. And nobody ever thought to go to the abdominal muscles. Yet when the horse fell on her, she immediately went into this
Exactly.
contraction
That's
that
what
pulled
you
up
do.
like this.
It's a
so
reflex.
the muscles locked up, and they have to. So often we find that these issues that people are having is because post surgeries and so forth, they'll go in and they'll do this work. The muscle gets traumatized, either from the fascial constriction or the muscle itself, and then the muscle will draw up tight. It'll have a certain amount of tension in it. Nobody manually releases it. Some people will try to do stretches, but it's not going to do the job.
I see.
It needs to be manually released. And once it's manually released, we're good to go.
Phenomenal.
Indeed.
Thank you so much.
Been a pleasure.
Absolutely wonderful. I hope you enjoyed it as well. Thank you so much for viewing this. If you have any questions, by all means, go to Aruka Touch in Beckley, West Virginia. You can either talk to them by phone, if you live in the neighborhood, if you feel you've been suffering long enough and you want to make the trip to West Virginia to just meet Lee and his wife Katrina, then by all means, do that. Look at our website. We'll put the website on the bottom of the screen. But thank you so much for listening. I hope you learned something. I learned a lot. Obviously, you didn't hear me talk much today, which is because I was listening and learning. So thank you so much for listening and viewing. And hopefully we see you on the next interview of Health in Focus with Jacobus. Have a good day.
Good job. Thank you.
Visit healthinfocusnow.com.